Dr. David Lai. I actually graduated from a science background in the University of Hong Kong. I had my biochemistry and microbiology degree back in 2014, and then I continued my study in medicine in CUHK. So after I graduated from CUHK, I worked in the hospital as a psychiatry trainee for 2 years. Then I came out and started my own company, WT Health. So actually, I'm a doctor, so I have the technical knowledge to understand all the medicine-related topics. And to start my very first clinic, actually I started my first clinic in the residential area. So it's not a high-end service, but we serve the basic need in the community, the very grassroots level of the citizens in Hong Kong. So after I started in 2022, which is just 3 years ago, I bootstrapped everything. So basically, from then to now, we have about 15 or 16 clinics until today. So in addition to the GP clinics that we have started long ago, we also have dental clinics and physiotherapy clinics in WT Health. So in the first part, WT Health is a medical group. We provide medical service through the clinics. But the second part is we promote medical innovation. Because we understand that medical innovation will be a very, very big topic in Hong Kong. Especially you see a lot of projects coming from the science part, from the government is advocating medical innovation or innovation in biotechnology. So actually, Hong Kong has a very high level of standard in university research and also medical services. So we try to make good use of this medical reputation to further support the growth in Hong Kong economy. So WTF actually, we also supported a medical organization called the Med House, which is also founded by me. We have 2,700 doctors in the group. And within this group, we try to connect with different industry parties, and also we try to invite the doctors who are interested in medical innovation. And we try to help together to support the startup in science park and different and from different parts of the world. So we do have medical service on one hand, and on the second hand, we support medical innovation.
There's this coming healthcare reform, which I think directly impacts you because you are serving the grassroots, right? And these are the people who use public hospital for outpatient services. So could you tell us two things? One is, what impact do you foresee this reform will have on the grassroots patients seeking public healthcare services when it's implemented? And then the second thing is, you mentioned something about training healthcare professionals. So, could you explain why there is a burning need for medical professionals to upskill today?
Okay, so very good point is we are going to face a huge healthcare reform in the very coming near future. And so the impact is that I would say this way. The root cause or the background of this reform is we don't have enough resources. The government is running out of budget. We all know that. And the second part is due to aging population and the increasing medical prices, inflation in medical expenses, we are facing a huge medical expense in the very coming in the future. So the point is we are trying to make it more efficient. We try to channel the demand to the supply in a more efficient way, and we try to, for the government, they are not just trying to match the demand and supply, they try to make patients have more self-empowerment, which means they need to have more responsibility for their own health. So they need to have the co-payment concept. So this is what the government is advocating. The patient have to pay for themselves for their health care, which from my perspective, it makes sense. But of course, we do need to cater the grassroots level. Maybe they're not that wealthy to cater all of their budget. So there will be some exemption or maybe some subsidy from the government for the grassroots level. But we do see this co-payment concept is growing in this upcoming future. So this will be one of the very major impacts. And how it impacts our medical group is that we do understand we are serving the grassroots level mostly. So we do have very close communication with the patients, understand their need. We don't try to over prescribe or do some unnecessary medical checkup. This is what I think is the right way to do a medical business. I'm a doctor because I do think that being ethical is very important in running a healthcare service. We do face very intense competition from mainland, from GBA area, and also from the upcoming AI era. And all this implies is we have to upskill ourselves to make ourselves more competitive. And I'm not sure whether you know what. For doctors in Hong Kong, we are actually receiving the third highest salary in the world, just after US and Canada. So the point is, for one part, we are, Hong Kong is a very expensive medical expenses, but we are very close to GBA area. To GBA, while we know that the cost in GBA is very minimal compared to Hong Kong, so we have to upskill ourselves to make this meaningful and make this reasonable, to convince the patient that we deserve such a premium to have to enjoy the service in Hong Kong. So I think for healthcare professionals in Hong Kong, we have to upskill and differentiate ourselves, trying to incorporate with medical innovation, with the technology, equipment, business model, try to make it to convince the patient that we are the premium service provider.
Now, apart from the outpatient services you provide, can you tell us what some of the other services you have? Because I saw that you have a few kinds of clinics. Can you just tell us the niche of your services?
Okay, so WT Health actually started from just a single GP clinic. Okay, then we grow, we expand, we scale up. We know our SOP, and then we do replicate. And for now, we have our dental segment. We have 4 dental clinics, and also we have 2 physiotherapy clinics in Hong Kong. And we do a lot of outreach services as well, not just in the clinic, but we go into the community, to our residential homes, to the OH homes, to serve the need, and also we arrange multiple outreach vaccination events in schools, in public areas. So the niche for us is that we don't mind getting in touch with the community. We go very near to the patients. We also have our clinics actually in remote areas, in Changzhou, in isolated areas. So we do think the medical need is there, but we try to tackle the difficulties and to bring our medical service to the patient, to their community.
Oh, that's a very difficult thing to do, especially during typhoon season in Hong Kong, isn't it?
Yes, correct. Yeah, correct. So there will be special arrangement, of course, but I do think that at least they have the very basic service met. Have upscaled and also up-to-date services and technology there.
Now, what's in the pipeline for WT Health? What can we expect to see from you this year?
Our major focus in upcoming years will be medical innovation, for sure. So the first part I just mentioned about is we have a doctor platform called MedHouse. We have 2 panels set up there. One is a biohealthcare expert panel. We invite specialists from different disciplines. We invite lawyers with a biochemistry background. We invite VC and PE firms there. We try to get an expert on the medical field. Then for this, we can evaluate group projects and we can help them to succeed in the work. And the second part is we organize a product trial panel, so which consists of a number of specialists in Hong Kong and also the frontline GPs, family doctors. We try to bridge the gap from technology to the patient. We know there's a huge gap there. So for example, if you have a very good technology, but it is very expensive, or you cannot work out the exact workflow, the clinical workflow there, so it cannot get into the patient, right? So, but this, for medical field, our network, our connections here is very close loop. So we try to break this pain point here. We connect everybody in the industry, and so we help them with the commercialization, we call it, okay? At least if you're a product, we try to work out the correct model, correct distribution model, correct business model, and the correct workflow and feedback. So actually we help with the startup, the medical startup, with economic study, pilot study, and also the clinical feedback. So I think very important point here is we do have a lot of medical experts in Hong Kong, but they are not unified. The resources is not collective enough. So what MedHouse or WTF is doing is we try to connect these resources, turn our expertise, the premium expertise, into innovation area. So we support the medical staff, maybe medtech, biotech, healthcare technology, and sometimes we co-invest in them. We invest in them. So the latest project WTF invested in is a 3D quantitative pathology. So I know it is a bit technical, but in simple words, it helps make a better informed decision on oncology treatment. So we call it precision medicine, and we also get help to support the staff in the cutting edge technology in the world, not just in Hong Kong, not just in China, but in the world. we assure that it is a best-in-class, first-in-class technology, and we try to, bring this to a level that every doctor in Hong Kong will embrace, will support technology, because we know that it is the era to, upskill ourselves.